And when I started preparing the second cavity, the patient had few changes, which I noticed after the cavity preparation. The patient's eyes started drowsing slowly, and since his BP was very low and his RDS also was very low, and when I tried to check his saturation, it was not recording properly. But since it was my first case of syncope, like only thing is like whatever medical emergency we have studied and further, just try to do the normal basic vitals and all. And after that, I really wanted medical emergency help. That was almost there for a week, where for each and every patient, I used to ask proper case history.
Hi viewers, myself Dr. Prince. Welcome to my channel, Dental Treasures. So imagine yourself when the patient walks into your clinic for a simple cavity preparation. So you roll up your sleeves, you take the aerotar, you want to make a beautiful cavity preparation. And then suddenly you realize there is some changes which is happening to the patient. And then suddenly he goes to syncope. So this situation, any dentist can undergo this. So let us find out from the doctor who's actually experienced the syncope cases and how she dealt with this. So let us welcome to the show Dr. Shalini Balavargan. She's got a clinic which is located in Chikkabanswadi. Name of the clinic is Vriksha Heart and Dental Clinic. Doctor, welcome to the show, doctor.
Thank you so much, doctor, for selecting me in this show to participate in my experience in regards of the syncope, where I could help the other fellow dentists also to be aware of such kind of cases and be very precautionary to take up the procedure.
So before starting the procedure, did you notice any changes with the patient? Was he calm? Was he relaxed? Or how was he?
The patient actually approached the dental clinic with a complaint of sensitivity, and I had advised him for a cavity filling and all the procedure, and the patient was comfortable. He had actually accompanied his father, and it was like a sudden plan. He just entered the dental clinic. The patient's age was 45 years and he was accompanied with his father. And actually I asked his medical history in regards of the hypertension and the diabetes. But one hidden thing was there in the patient, that was he was very phobic to the dental motor sounds. And he was very jovial kind. He was talking and he said, because of the sensitivity, I kept asking him how he is feeling, like is he feeling very sensitive or what was that cavity preparation and all. So the patient told that he is not sensitive and he was communicating good. When the first cavity preparation was done and the filling was done, the patient was all normal. And it was 2 teeth where the cavity had to be prepared. And when I started preparing the second cavity, the patient had few changes, which I noticed after the cavity preparation. The patient's eyes started drowsing slowly. So that is where I noticed some new changes in the patient. When I'm trying to respond and I'm trying to call out his name, he's not responding good towards me.
So how long did you take to prepare the first cavity and how long did you take to start the second cavity?
The first cavity, like I hardly took few minutes only to prepare the cavity preparation, and as I only do composite fillings here, so it used to be in 3 steps, right? As you know, it used to be like etchant and bonding and then the composite filling. You give a light UV light towards the preparation and the filling. But the first thing, he was all fine. When the second thing, he started dozing off.
Once the patient dozed off, what is the situation and how do you handle that?
Actually, the patient dozed off. I started getting him to consciousness by calling out his name, but still the patient didn't respond. So as in we have all the BP apparatus and the GRBS and everything, I started checking all the vitals, basic vitals I started checking. And since his BP was very low and his RDS also was very low, and when I tried to check his saturation, it was not recording properly. So that is where then I had to seek a medical emergency. I called a medical specialist and I had to treat the patient.
I'm sure situations like this will actually freeze our thoughts. So, how did you handle this panic situation? What are the thoughts which is running in your head at this point?
Thought was really very panicking actually. It was very scary to say, frankly. But since it was my first case of Syncope, like only thing is like whatever medical emergency we have studied and further, just try to do the normal basic vitals and all. And after that, I really wanted medical emergency help, wherein they gave the IV fluids with dextrose and all those things, and then monitored his ECG. Once his ECG was normal, again we told the patient to sit for a while, and then I completed the procedure and then only sent the patient back.
So, how did this incident impact you further?
This made me learn more and made me to be very alert to take the proper patient's case history. The problem was the patient didn't open up with his phobia complaint. That was the only issue. Otherwise, everything was fine.
Did you complete this procedure?
After all the first aid things has to be done for him, as I told you previously, IV dextrose was given, and then cardiology consent was taken, and the cardiologist took a ECG. And once the ECG was normal, we made the patient wait for a while, checked his BP, again his GRDS. Only when everything normalized, we asked the patient what was the problem. So he gave a complaint that time saying that he was phobic to the dental machines, for the sounds of the dental machines.
So, which is revealed at that time?
Yeah, revealed at that point, where the cavity was already prepared, so no more machines was about to be used.
Okay.
So only the filling part was left to the second cavity. So I just did the filling thing and I sent the patient comfortable.
So, was it on the same day you completed the procedure?
Both the things same day. After reviving him, we completed the procedure and then only sent the patient.
So, doctor, did you have a follow-up with this patient?
The patient came back for his regular checkup and everything, and then he had another tooth which has to be extracted, which we advised him that will take a little time and then we will do it. We just gave him, put him on antibiotic and painkiller, we sent him. He's not come back to the procedure.
So, if the same patient comes after 3 months, will you have the same phobia as a dentist because you've experienced all these things, trauma? So, will you take up this case or how are you going to approach this case?
Yes, doctor. We will definitely take up this case with the proper medical emergencies. If at all anything goes wrong, we'll have to support the patient in that way. This treatment has to be done. So, we'll definitely take up the case.
This has definitely impacted you. So, can you just share your experience after this Syncope episode? For how many days you had that fear in your mind?
It's been my first experience with the Syncope patient, and the impact was almost there for a week, where for each and every patient I used to ask a proper case history regarding their medical complaints and then only start up the case.
So luckily, doctor's husband is a cardiologist, so I'm sure there must be a lot of support and help from his end. But unfortunately, everyone won't be getting this kind of a support. So can you just explain how did he help you with this?
He was very supportive towards me, and it was till my 3 years of practice, my own practice, I have seen 2 Syncope cases. And my husband is a very big backbone and he's been very supportive towards me in my practice. So he's always been my backbone, he's been very supportive, he's teaching me a number of things to be learned, still more to be learned, and we have to be very alert towards all the procedures. That is my only kind of request.
Thank you so much, doctor, for sharing your experience. We all learned this during our PDS time, how to handle the medical situations, emergencies and all these things. But when it comes to this actual situation, things are totally different. I'm sure those things won't enter our head at that particular time. So these experiences will actually make you stronger in the future. At least you'll be more confident how to handle the cases. And this will definitely be a great message for the other viewers. And thank you so much, doctor. Any last message for our doctors?
Thank you so much, doctor, for being selecting me in this show, and where I could share my experience to the other fellow dentists, which would be very helpful. Kindly be very careful when you're selecting the cases. you have to select the case very carefully by taking a proper case history, and the case selection should be very important, and you should not hurry up with the procedure. First of all, take a basic vitals of all the cases, and then according to their medical compliance and everything, we have to proceed with the procedure. And if the patient is a cardiac patient, you should take the consent of the cardiologist and then proceed with their, according to their instruction, we have to proceed with their procedures.
So, my dear fellow dentists, so now you know the significance of taking medical history. So, I'm sure patients will be waiting outside. You will be in a hurry to complete the procedure, but it is important in depth that you have to take the medical history. And even during the procedure, you have to ask repeatedly how the patient is. You have to check for the vitals. Don't just focus on the cavity preparation or root canal or extraction. Just talk to the patient, have a good communication with them. So my request is that please do like and subscribe this channel, and also I'll give you the description what doctor has already mentioned, and please do click on the links so that it will be helpful for the other doctors and fellow dentists. Be it a job, whether it's to find a clinic or if you need a staff. So all the description is given below. So please do check out that. So in the next episode, we will directly interview a cardiologist and we'll discuss if situations like this arise during our dental practice, how to handle it. And I have a list of questions to be prepared. So my dear friends, please do follow this channel. And if you like this content, do share it with your friends. And let's find out what happens in the next episode. Thank you so much.
Again, it's a tough time to decide because in myocardial infarction with diabetic people, there will be a silent MI also. You have to be too fast in handling the patient, but nothing to get panic. Until if it is an emergency, 6 months is okay, but generally we have to give duration for at least minimum 1 year. We have to be very careful while giving the local anesthesia, medicines like lignocaine.